In this section, we will be taking a look at the concept of infection and immunity. The objectives are looking at influenza, pneumonia, tuberculosis, and HIV, identifying the risk factors and prevention methods, planning evidence-based care for all four of these diagnoses. Student learning outcomes are going to center around providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy, demonstrating critical thinking and clinical reasoning when providing quality patient care in community-based settings, communicating effectively with patients, families, and members of the interprofessional team, and managing care for clients and groups in diverse settings. We're first going to take a look at influenza, looking at the risk factors and prevention. Risk factors are one being age. Those that are very young or very old are at risk. So infants and young children, and then anyone over the age of 50 as well. Those in long-term care facilities, because of the fact that typically they're older adults and the physiological changes that occur with the aging process puts them at higher risk. And then they're also exposed to more people with the potential for influenza. Any chronic conditions, especially with cardiac and respiratory, diabetes does put individuals at higher risk. Those with weakened immune function, so anybody that is either immunosuppressed because of medication or immunocompromised. Pregnant women, particularly in the second and third trimester, and then healthcare providers as well. So the number one prevention strategy is influenza vaccine and hygiene intervention. So really good, effective hand washing, and then provide that education to the clients as well. Those should be getting vaccinated, and then the hand hygiene. Influenza symptoms are listed here. Generally, they last for a couple of days. The fever can last up to a week. If there is respiratory involvement, it usually will take several weeks for the cough to resolve, and it's supportive therapy during the symptom management. You also want to take a look at the pathophysiology and etiology of influenza in your textbook. In this section, we're particularly just going to focus on the management, the pharmacological therapy and non-pharmacological therapy. For medications, antiviral drugs will actually prevent the release of newly formed viruses from the surface of the infected cells and actually inhibits the replication of the influenza A and B. Two different types. The zanamivir is an inhalation medication and should be avoided for anybody with chronic respiratory conditions such as COPD and asthma. And then the second one is oseltamivir, and this is an oral medication that is given that is an antiviral drug as well. Also, non-pharmacological therapy, really it's focused on the supportive therapy, bed rest, promoting rest and sleep as much as possible so the body can heal. Adequate fluid intake to prevent dehydration, and also to help liquefy and thin secretions as much as possible, especially if it's going into the respiratory tract. And then the hygiene interventions as well. Maintaining good hand hygiene, disposal of tissues, making sure that they keep distance when coughing and sneezing from anybody that they may be living with or come in contact with. With pneumonia, we are again going to take a look at the risk factors, prevention, and management within the community setting. With the risk factors, very similar to influenza, age is going to impact the infants very young and the older adults, because older adults have decreased immune response and immune function because of physiological changes. Chronic conditions are going to place at higher risk, particularly those with cardiac and respiratory involvement. Weakened immune function, once again, smoking puts individuals at higher risk for pneumonia, and then also alcohol and drug use. As far as prevention, very similar to pneumonia, vaccinations play a key role in anybody that is high risk. As far as any of the risk factors associated with age, chronic conditions, weakened immune system, smoking, alcohol, and drug use, anybody that falls into that category should receive a pneumococcal vaccine, and particularly anybody over the age of 65. There also can be an additional dose given if needed at a later date. Also, the influenza vaccine, because influenza is tied to pneumonia in many cases. And then also early detection and early treatment is a key to symptom management. You can see the symptoms that are listed for pneumonia. There are localized and systemic symptoms. Your cough, your excess mucus production, shortness of breath, and chest pain are going to be more of your localized symptoms. Your fever, malaise, and diminished appetite are going to be systemic. Also, to keep in mind, older adults will present slightly different because of those physiological changes. They may not have a fever because of decreased ability to thermoregulate. They will be very tired, weak. The diminished appetite applies to them, but there's also cognitive changes, and then also there could be tachycardia and new onset incontinence as well with an older adult. So a little bit different presentation with older adults versus the normal age adult. In taking a look at pneumonia with the management, we're going to be focusing on the community setting. So it's going to be education as to completion of medication, if they are prescribed antibiotics, to make sure that they are able to obtain the antibiotics, store it properly, and then also take it until it's completely gone. So education as far as that is concerned, promotion of rest as much as possible, adequate fluid and nutritional intake to support the immune function in the healing process, and then when to notify the physician. And these symptoms are going to be for shortness of breath, any difficulty breathing, increased fever, fatigue, headache, sleepiness, or confusion. They definitely want to notify the physician immediately. And also taking a look at your vulnerable population, again, providing the education in a meaningful way that you're addressing all of their individual needs as well. Tuberculosis is a chronic recurrent infection caused by the organism Mycobacterium tuberculosis. And what ends up happening is this organism is transmitted by droplet nuclei, and it will enter into the lungs, and through an inflammatory process, it actually can become sealed off. If you have a very high-functioning immune system, what the body will actually do is encapsulate this colony of the organism, and it will just lay dormant within the lungs. If you have a compromised immune system, what ends up happening is the body is not able to encapsulate or surround the colony of bacteria or organisms. I should say it's not bacteria, it's organisms. And then what ends up happening is it becomes an active form. And this active form is what ends up causing the tuberculosis pneumonia, and it could progress to other body systems, including the kidneys, the urinary tract, the brain, the bones, and the joints. So as you can see, the risk factors, and if you think about it, it makes sense, because if you have a compromised immune system, you are going to be at higher risk for the active form because your body is not able to encapsulate the organism. So anybody with a compromised immune system, which includes people with HIV, AIDS, alcohol and drug abusers, homeless, anybody with a low socioeconomic status because of the malnutrition and the more crowded living environments that result. And then also immigrants, because in certain parts of the world, there are higher rates of tuberculosis. Prevention is centered around the skin testing that everybody has gone through. And of course, you can't screen everybody. So really what the recommendation is to just focus on those high-risk individuals. So those listed on the slide, anybody with medical risk factors, medically underserved individuals, also residents of long-term care facilities. Most places will automatically, when you are admitted into a rehab or a long-term care facility, will do a two-step tuberculin test for all individuals to rule out that there's no active form. And I want you to take a look in your textbook, and it's page 609. It's table 9-17, how to interpret the skin test results, and it really is specific to the risk factors. So what you're looking for is you do an intradermal injection, and then you wait up to 72, it's usually 48 to 72 hours, and then you're looking for an area of induration, which is a raised reddened area. That means that it is reacting and that there is an active form, or it could be encapsulated as well, but there is exposure to tuberculosis. And then depending on, again, your risk factors is what area of induration you will be looking for. So you do need to be familiar with this, because in the ambulatory settings and then also in Breckenridge, we do read results from time to time. So you do need to be familiar with how to read them. As you see what the symptoms and the clinical manifestations are for the active form of tuberculosis, and most of the time facilities will have screening questions to identify those that may be potential risks. And usually you're asking, have they had any fevers, night sweats, unexplained cough, or coughing up blood. And anybody that screens positive will actually be treated as if they are displaying an active form of tuberculosis, and it is an airborne isolation. In taking a look at tuberculosis management, it does center around pharmacological therapy. The differences with prophylactic versus active form of tuberculosis. Prophylaxis is you are trying to prevent the active form of tuberculosis from occurring. This is usually treated with one class of medication and is effective with preventing the active form. Treatment of active disease centers around at least 2 of the anti-tuberculosis drugs, up to 4 and 5 of the classes of these particular drugs. They all work a little bit differently, and they are all needed in order to effectively treat the active form. We will be taking a look in class at the different classifications and their mechanism of action at a pharmacological cellular level. I do want you to take a look at your textbook. It gives some nursing considerations and mechanism of action for the 5 classes of the anti-tuberculosis drugs. So you definitely want to know these, particularly looking at the nursing considerations and the education that you would provide to the individual. And then also, the education is very important. You want to be educating about preventing the spread of the disease to other people. So in coughing, sneezing, talking with other individuals, trying to avoid exposure to crowds, and kind of self-isolating for a period of time until the medications start taking effect. They need to have proper diet and fluid intake in order to support their systems during the disease process. They also need to understand the different classes of medications and how each class works. That's why it's very important for you as the nurse to be able to explain the differences, because a lot of patients will look at you and say, I have one disease, tuberculosis, and I take 4 medications that are all anti-tuberculosis drugs. Why is that? So you need to be able to explain that. Also, the side effects that can occur and what to look for all the different classes of the meds. Avoiding alcohol, because some of the classes of medication will damage liver, and that fluid intake is going to be important because there are some classes that have renal impairment associated with them. And then what they want to report to their healthcare provider as far as progression of the disease or signs and symptoms of a reaction to the medication. Adherence is a significant concern for those managing tuberculosis. I mean, if you can imagine 4 medications that need to be taken, sometimes with the addition of other classes of medications as well. If you are dealing with high-risk, vulnerable individuals, how compliant are they going to be, and are they going to be able to carry out that regimen of medications? So these patients may not be able to afford the medication, they may not be able to store the medications, and they're primarily concerned with those lower levels of the Maslow's hierarchy, that taking medication is probably not going to be on the high list of their priorities. So a lot of times you may have to refer these particular individuals to the public health department for management and follow-up, because sometimes the public health community nurse needs to monitor and administer the medications to ensure that that individual is adhering to that regimen. So they actually may have to watch those individuals swallow the meds. So then they're helping themselves, but they're also preventing the spread of infection and disease to other individuals. So that adherence is a huge, huge issue. In taking a look at HIV, we're going to mainly be focusing on the risk factors and the prevention associated with HIV. First risk factor would be behavioral, as far as engaging in unprotected sexual activity, IV drug users, sharing needles, also alcohol and drug abuse, because risky behavior is more prominent in engaging in unprotected sexual activity. As far as transfusions, there has been much more aggressive screening. However, there still is a window between contracting the HIV infection and it presenting itself within the blood. It can take anywhere between 6 weeks to 6 months. So if somebody is donating within that time, that there still is a possibility. However, they try to also screen as far as lifestyle, and if there's any risky behaviors, that person is not able to donate. Healthcare providers are at risk because of the exposure to blood and body fluids, accidental needle sticks, can increase the chance of contracting HIV if it was obtained on an HIV patient. Poverty increases the risk of HIV because of the fact that there may not be exposure to education, and also literacy can play into it as well. Access to protection for engaging in sexual activity, condom use, people may not be able to afford, so they choose not to use protection because of that. Pregnancy and breastfeeding, there actually is much more HIV screening being done in prenatal care, and if a pregnant female is identified as being HIV positive, then they are encouraged to not breastfeed, and then also to receive treatment with antiviral therapy. This actually drastically decreases the risk of transmitting to the fetus. Also, cesarean delivery is preferred because of decreased exposure to the mother's blood and body fluids. And then older adults are at risk due to the fact that a lot of older adults do not engage in protected sexual activity because of the fact that they do not think that STDs and HIV is something that they can contract. And then also, with women with menopause, they no longer have to worry about the risk factor of pregnancy. So a lot of older adults do not use protection because of those facts. As far as prevention, centers around the risk factors, a lot of education as far as behavioral, educating about safe sex practices, using protection for any and every sexual encounter, whether it is vaginal, oral, or anal, making sure that they have access to protection and condoms. A lot of clinics will distribute condoms for people that cannot afford them. Also, at the homeless stand-down every year, there's usually a table that does HIV testing and distributes condoms as well. Preventing and treating opportunistic infections in HIV clients to try to prevent the progression and to slow down the progression to AIDS. Using standard precautions in healthcare. So you treat every patient as if they were exposed, have contracted some type of infection, whether it be HIV or pretty much anything. So you just treat every patient the same, use standard precautions. There's also post-exposure prophylaxis, and this is if in the event that healthcare professionals are exposed to blood or body fluids or have a needle stick, that very, very prompt treatment where they draw the healthcare provider's blood, the client's blood, and they actually will test to see what the risk is. And if the patient or the client does have any risk, they are offered post-exposure prophylaxis. If it is initiated within 2 to 3 hours after the exposure, it actually decreases the probability of the healthcare provider having HIV, and there is an 85% cure rate for if the client does have HIV, if it is initiated within that 2 to 3 hour window. So if you do have an exposure, you want to make sure that it is addressed immediately. And then typically the medication that is offered is the Zidovudine, and this is the primary one. You do want to take a look in your textbook. Let me see here. It is on page 470. It's the antiretroviral nucleoside analogs, and particularly take a look at the one that's listed here, the zidovudine, and typically it's AZT that's administered for prophylaxis.